Welcome back. Well, for many of us, staying focused gets harder by the day. Less, no names.
What?
But for more than 6 million American kids, ADHD is a diagnosed disorder. It is most commonly treated with prescription medication. But in today's Ask Dr. Jenny Wilkins from AgeVital Pharmacy is here to help families looking for alternatives to prescriptions. And I know as a parent, you know, it just seems kind of a little scary to say, okay, here's medication that my child is going to need to be on long term. So hopefully that isn't something we have to do.
Yeah, I call it Band-Aids for boo-boos. Here's your blue pill, your purple pill, your yellow pill, your that pill. Our children are not Adderall deficient or Vyvanse deficient or Ritalin deficient. The body actually functions very much like a car. Okay, what chemicals are out of alignment in your body, whether it's neurological in an Adderall, Vyvanse, Ritalin, these are all neuropsychiatric medications. Long-term side effects, yes, it would be like a quick fix for somebody that's totally spastic, maybe like Les, right?
Yeah. Thank you very much. Just use me as an example anytime.
Well, let's start.
Of someone who is completely...
You know, we hear the phrase all the time, oh, I'm ADD, I have so much going on. Let's get a good definition of what exactly is ADHD. I mean, aren't all kids hyper?
Yeah, well, sugar, lots of sugar, the diet, a lack of nurturing our environment, the stimulation on TV, everything plays a factor in it. But right now, I would say the stat is about 82% of Americans claim to have ADD. That's huge. That's horrifying. And there must be something wrong in our society where it's like, why are people not being able to focus?
Why
it's
are
not
we
just
feeling
children.
like that?
Yep. Why are we feeling like that? And then you have two different categories. You have the ADD, which is just the attention deficit disorder, where you could just focus on one thing. And then you have the ADHD, where you're just focusing on a bazillion things, like multiple trains running at once. And you have children that even describe it as that. They're like, I'm hearing a bazillion conversations at once, and I can't focus on your conversation.
So what is our deficiency? What do you think is lacking within us?
First, when we could do actual clinical screenings through urine, through blood, through saliva, even hair testing.
Oh, wow.
Okay, that could actually show you evidence-based nutritional deficiencies and hormonal deficiencies. B12 is a big one. Amino acids, that's huge. Children that are hyperactive, it's because they're not absorbing their proteins. And then when you're seeing how our foods are all genetically modified, hormonally tampered with, the GMOs, we're not getting any nutritional value from our foods. So if we're not absorbing the nutrition that's in our foods, then we're not feeding our brains, and our chemicals are misfiring, very much like spark plugs in a car.
So what's the solution without getting on medication?
Getting tested, looking, you know, for real deficiencies, or going in and getting children on bioavailable amino acids, bioavailable B complex. I even have a melatonin cream, even a CBD cream derived from hemp, cannabis, applied on the back of the neck. There's a local neurologist here, Dr. Ronald Ongden, who's got 197 patents on neuropsych medications, getting children off of Adderall, Ritalin, Vyvanse, and actually feeding the body what it needs, as opposed to just, here's a Band-Aid for another boo-boo, and then not actually focusing on the root of the problem. Because like I said, you need to focus on the root.
To be tested, is that a blood test?
A blood test, saliva, urine. A lot of children will just, you know, pee in a cup, send it out to LabCorp, to Quest, to Age Diagnostics, any lab test now.
One of the things I got to say on this is, because I think everything you're saying is right on the money, and I've dealt with some of this, but the expense involved, insurances do not cover this stuff. They don't consider it something that is a have to. They consider these types of things as electives. So that's where I see sometimes it being a challenge for lower income people, even moderate income people, because these blood tests and going to these types of doctors and everything is very expensive.
So is that how they end up with Ritalin? You know, is that why Ritalin has become America's Band-Aid for this?
Yeah. That's actually a very good point, and it is. There's a lot of insurances that stopped paying for the natural way of healing the body and saying, okay, well, your quick fix is just going to be this pill. It's almost like, let's push an agenda here.
Right.
Yeah, it's very sad
rather than looking at what our body
needs. Here's our children. And then there's a new stat out there that shows the children of today, the 7-year-olds to 12-year-olds that are on Vyvanse and Adderall and Ritalin, are going to be the schizophrenics and bipolar community by time they're in their late 20s.
Oh, no,
Right.
that's
So
not
by
good.
doing some
Because-
testing, by looking at what your body is actually missing or the kids' bodies are actually missing,
Exactly.
then we can start to do some look into
Right,
things
and you
that
have
don't need
horrible side
prescriptions.
effects. It's like maybe 1 pill, 2 pills. I mean, I was in college. I took Adderall just so I can stay up because
Right.
this is something college students are popping just to study and have all-nighters.
Yeah.
And
It becomes an
wake up.
epidemic.
It becomes an, and I remember my husband, when I put him through pharmacy school, it's one of those things, but then you see the side effects. You start losing your libido with men. With children, you become withdrawn. It's almost like it inhibits their personality where they're just behind a glass wall.
Oh, wow.
And now they're not, and damaging the prefrontal cortex of the brain, meaning Alzheimer's, dementia, bipolar disorder, schizophrenia, other neuropsych disorders as opposed to just the
key is to get
hyperactivity.
tested and find the real solution.
Yep.
Vitamins,
Get tested
amino
and look for
acids,
some natural
diet.
solutions. That coming from Dr. Jenny at AgeVital Pharmacy. And by the way, we want to mention that AgeVital Pharmacy has a gorgeous new store on Main Street at Osprey, right?
Yep, no, Main Street and Orange.
Main Street
Yep,
and
we're
Orange.
right down the road from here.
Yep, and downtown
Great.
Sarasota. You cannot miss the bright blue storefront. And it's a gorgeous
Very bright.
facility, so stop in there and ask Dr. Jenny yourself. And their store is also still open on St. Armand's Circle. All right, thank you very much.
you.
Good information for many
Congratulations. That's
concerned
great.
parents. And coming up, we're going to take a look at a couple of emails before we head to the kitchen. Stay with us.
Are they about me?